So today we're going to talk about Lovastatin, which is a drug that lowers cholesterol. But before we can talk about how it can lower cholesterol, we have to talk about what cholesterol is and how it's synthesized in our bodies. So cholesterol is important for us because it's an important component of our cellular membranes, and it's also the precursor for a lot of hormones and bile acids. And even though it is important for us, when it gets to a point where cholesterol is too high in our bodies, this can lead to a lot of health problems because it constricts in our blood vessels and it builds up, and basically that can lead to a lot of health issues that includes heart disease and stroke. So cholesterol biosynthesis starts with the conversion of acetyl coenzyme A to HMG coenzyme A. This occurs in a series of reactions with the help of HMG coenzyme A synthase and thiolase. Then from there, HMG coenzyme A is converted to mevalonate with the help of HMG coenzyme A reductase. This is the rate limiting step of cholesterol biosynthesis, and it's also a really important step to know because when it comes to lovastatin, we're going to be revisiting this step to understand how lovastatin helps to lower cholesterol. Mevalonate is then converted to phosphomevalonate to mevalonate 5 phosphotransferase. And then phosphomevalonate is then converted to 5 pyrophosphomevalonate through phosphomevalonate kinase. 5 pyrophosphate mevalonate is then converted to isopentenyl pyrophosphate. Isopentenyl pyrophosphate is then converted to dimethyl allyl pyrophosphate. However, 4 isopentenyl pyrophosphate molecules and 2 dimethyl allyl pyrophosphate molecules are then condensed to form squalane in a series of 3 reactions. Then squalene is converted to 2,3-oxidosqualene with the help of squalene epoxidase. 2,3-oxidosqualene is converted to lanosterol with the help of oxidosqualane cyclase. And then lanosterol is converted to cholesterol in a series of 19 steps. Now that we know the importance of cholesterol and how it's made and what happens if there's too much of it, now we can talk about lovastatin and how it helps lower cholesterol in our bodies. A statin is a class of medication that is responsible for lowering cholesterol in our bodies. So this can be lovastatin, atorvastatin, pravastatin, simvastatin, and rosuvastatin. Lovastatin acts as a competitive inhibitor, and it does this by inhibiting the enzyme HMG coenzyme A reductase. That is the rate limiting step of cholesterol biosynthesis that we spoke about earlier. This enzyme is responsible for converting HMG coenzyme A to mevalonate. So lovastatin is going to be competing with the substrates of this enzyme in order to prevent the cholesterol biosynthesis from continuing. Lovastatin must be converted to its active form in order to inhibit HMG coenzyme reductase. And this occurs in the stomach. When somebody swallows the lovastatin pill, it goes into the stomach and then it's activated to its beta hydroxy acid form, and then it can start inhibiting the HMG coenzyme A reductase. Although this medication helps lower cholesterol for patients suffering from high cholesterol, it is important to also inform patients on the need for lifestyle changes that includes exercise and eating healthier. As discussed earlier, cholesterol is still important for us. It's important for our cells' membranes, our hormones, and bile acids. And so if this medication is prescribed at a really high dose, this can actually lead to low cholesterol, which is still not good for us. So it's important for healthcare providers to monitor their patients when they're prescribing their patients a statin, because you want to make sure that it's not too low Otherwise, the dosage would have to be altered for that patient.